What causes gout flares when starting Pegloticase? Imagine trying to clear a stubborn stain from your shirt. Sometimes, the process can cause a bit of a mess before things get better. Starting Pegloticase for gout is similar. Gout is caused by high uric acid levels in the blood, which lead to crystals forming in the joints. Pegloticase is a special medication that helps lower these uric acid levels by turning it into a more soluble substance called allantoin, which your kidneys can easily remove. It's used for people with very tough, hard-to-treat gout. When you begin Pegloticase, many patients notice an increase in gout attacks or flares. This happens because the medication works quickly to lower uric acid levels. As the uric acid drops, crystals that have built up in the joints and tissues start to break apart and dissolve. This process can irritate the joint tissues, triggering inflammation and pain. Think of it like a sponge that's soaked with dirt. When you squeeze it, dirt gets released all at once, causing a temporary mess. This initial flare is a common part of the treatment process. It's caused by the body's response to the sudden change in uric acid levels and the mobilization of urate crystals. The crystals that have been stored in tissues are now being released, which can cause swelling, redness, and discomfort. That's why doctors often recommend taking medications like colchicine or non-steroidal anti-inflammatory drugs before starting Pegloticase. These help prevent or lessen the severity of flares during the early stages of treatment. Most patients experience the highest risk of flares during the first 3 months of Pegloticase therapy. After this period, as uric acid levels stabilize and the body adjusts, the frequency of gout attacks usually decreases. It's important to keep taking the medication as prescribed and to manage any flares properly. Stopping treatment too early because of flare-ups can mean missing out on the long-term benefits of lowering uric acid and preventing future attacks. Always discuss any concerns or flare-ups with your healthcare provider to ensure safe and effective management of your gout.